Hey guys, this is FixerMed. Welcome back to my high-yield anatomy review series for the USMLE Step 1, NBME CBSE, and NBME CAS examinations. In this series, I will be covering a broad overview of the discipline of anatomy across various organ blocks for these examinations. This will be part 44 of my multi-part video series of doing so. Without any further delay, let's go ahead and get started on today's content. Let's start off by taking a look at paracentesis of the urinary bladder. Suprapubic aspiration. Urine can be extracted from the bladder without penetrating the peritoneum by inserting a needle just above the pubic symphysis. The needle passes sequentially through the skin, superficial and deep layers of the superficial fascia, linea alba, transversalis fascia, extraperitoneal connective tissue, and finally, the bladder wall. Let's next take a look at prostate tumors. Prostate cancer. Typically originating in the posterior lobe of the gland, prostate cancer often presents without symptoms in its early stages. As the disease progresses, malignant enlargement of the prostate can lead to narrowing or obstruction of the prostatic urethra. Note: prostatic malignancies commonly metastasize to the vertebrae and brain due to extensive connections between the prostatic venous plexus and the vertebral venous plexus via the sacral veins. Let's next take a look at benign hypertrophy of the prostate, BHP. BHP is prevalent in men post-middle age. Prostate adenoma, also known as benign hypertrophy, typically affects the median lobe. BHP commonly causes urethral obstruction resulting in nocturia, nighttime urination, dysuria, painful or difficult urination, and urgency, sudden urge to urinate. The prostate is assessed for enlargement and tumors through a digital rectal examination. All right, guys, now that we have covered all of the content, let's go ahead and take a look at some questions to review the knowledge you have gained so far. A 67-year-old man presents to the emergency department with acute urinary retention. He has a history of benign prostatic hyperplasia, BPH, and reports that he has been unable to urinate for the past 12 hours despite feeling a strong urge. Physical examination reveals a distended bladder. The decision is made to perform a suprapubic aspiration to relieve his symptoms. During the procedure, the needle must pass through several anatomical layers to reach the bladder. Through which of the following layers does the needle not pass during a suprapubic aspiration? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is C, peritoneum. During a suprapubic aspiration, the needle is inserted just above the pubic symphysis to access the bladder without penetrating the peritoneum. The path of the needle includes the skin, superficial and deep layers of the superficial fascia, linea alba, transversalis fascia, extraperitoneal connective tissue, and the bladder wall, but it does not pass through the peritoneum. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, skin. This is the outermost layer that the needle must pass through to reach the bladder. B, superficial fascia. Both the superficial and deep layers of the superficial fascia are penetrated during the procedure. D, linea alba. This midline structure of the anterior abdominal wall is also traversed by the needle. E, transversalis. Fascia. This layer, lying between the linea alba and extraperitoneal connective tissue, is also part of the needle's path to the bladder. All right, now that we have covered this question, let's move on to look at the next question. A 72-year-old man visits his primary care physician with complaints of difficulty urinating, including a weak stream and a feeling of incomplete bladder emptying. He also mentions experiencing lower back pain. Digital rectal examination reveals an enlarged prostate with nodules. The physician suspects prostate cancer and orders a biopsy. Understanding the common metastatic pathways of prostate cancer is crucial for further management. Which of the following is the most likely site for metastasis of prostate cancer in this patient? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is D, vertebrae. Prostate cancer often metastasizes to the vertebrae due to the extensive connections between the prostatic venous plexus and the vertebral venous plexus via the sacral veins. This pathway allows cancer cells to travel from the prostate to the spinal column, leading to bone pain and potential spinal cord compression. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, liver. While metastasis to the liver can occur in advanced prostate cancer, it is not as common as to the vertebrae. B, lungs. Lung metastasis can happen, but is less common compared to bone metastasis in prostate cancer. C, brain. Metastasis to the brain can occur, but is relatively rare in prostate cancer. The vertebrae are a more common site due to the venous connections. E, kidneys. Kidney metastasis is not typical for prostate cancer. The disease more commonly spreads to the bones, particularly the vertebrae. All right, now that we have covered this question, let's move on to look at the next question. A 68-year-old man presents to his urologist with complaints of frequent urination, especially at night, nocturia, difficulty starting and maintaining urination, dysuria, and a sudden, strong urge to urinate, urgency. He has a known history of benign hypertrophy of the prostate, BHP. During the physical examination, the urologist performs a digital rectal examination, DRE, and confirms an enlarged prostate. Which of the following anatomical structures is most likely involved in benign hypertrophy of the prostate? All right, I think I gave you guys enough time here. I'm going to move on to see what the correct answer is and what the reasoning behind it is. If you need more time, feel free to pause the video. Otherwise, moving on now. The correct answer is B, median lobe. Benign hypertrophy of the prostate, BHP, typically involves the median lobe of the prostate. Enlargement of this lobe can compress the urethra, leading to symptoms such as nocturia, dysuria, and urgency due to obstruction of urinary flow. All right, let's go ahead and see why the other answer choices are incorrect. The incorrect choices can be explained as follows. A, anterior lobe. The anterior lobe of the prostate is less commonly involved in BHP. Enlargement of this lobe does not typically lead to the urinary symptoms associated with BHPC posterior lobe. The posterior lobe is more commonly associated with prostate cancer rather than benign hypertrophy. It is less likely to cause the symptoms described. D, lateral lobes. While the lateral lobes can also become hypertrophic, the median lobe is most often implicated in causing significant urethral obstruction in BHPE urethral sphincter. The urethral sphincter is not directly involved in the hypertrophy process of the prostate. However, its function can be affected secondarily due to urethral obstruction caused by the enlarged median lobe. All right, guys, that is all I have for the video today. As always, be sure to leave a like and subscribe to the channel for more videos like this if they are beneficial to you. If you have any questions, comments, or concerns, please feel free to type them up in the comment section below. Anyways, guys, this is FixerMed signing off. Be sure to have a great day, everyone. Good luck studying as always, and goodbye.